Secretary Wes Streeting.
Thank you. With your permission, Mr. Speaker, I'd like to make a statement on the outbreak of meningococcal disease in Canterbury and East Kent. My thoughts, and I'm sure the thoughts of the entire House, will be with the families and friends of those two young people who've sadly died. I cannot begin to understand what they must be going through. This is an unprecedented outbreak. It is also a rapidly developing situation. With these considerations in mind, Mr. Speaker, it is absolutely paramount that we stick to the facts, which is what I intend to do. This is the current situation. As of 9:30 this morning, UKHSA has confirmed 4 cases of Group B meningococcal disease, with another 11 cases under investigation. The 2 deaths are associated with this cluster. The majority of cases link back to the Club Chemistry nightclub over the dates of the 5th, 6th and 7th of March and their associated networks. Club Chemistry is currently closed voluntarily. Going forward, Mr. Speaker, these figures will be updated publicly by UKHSA each day at 9:30 a.m. Let me now turn to the timeline of this outbreak. UKHSA was notified about the first case on Friday the 13th of March. In line with established protocol, health officials began identifying and tracing the patient's immediate close contacts who were offered prophylactic antibiotics as a matter of urgency. On Saturday, UKHSA were in touch with the University of Kent to ensure they had the necessary support, advice and guidance and to establish where the patient was living. Also on Saturday, the French authorities alerted UKHSA to a second confirmed case in France from an individual who had attended the University of Kent. Both cases lived in private accommodation, and at that stage, there was no apparent link between the two. At 7 p.m. on Saturday evening, hospitals reported that a number of severely unwell young adults were presenting with symptoms consistent with meningococcal disease. Contact tracing of these individuals began immediately and continued into Sunday morning, March the 15th. All those traced were offered precautionary antibiotics. So far, 700 doses have been administered. Recognising the scale of the potential outbreak, at 10 a.m. on Sunday, UKHSA stood up a full-scale response, including preparations for more widespread distribution of antibiotics on campus. By 5 p.m. on Sunday, those antibiotics were in place and distribution began to students in the 2 halls of residence where we were aware of cases, and by 6 p.m. a public health alert was issued. Mr. Speaker, it is important that the House and the wider public understands that even before the public health alert was issued, students and young people who had been in close contact with suspected cases were being offered antibiotics. This is precisely what one would expect as a rapid response, and I'm confident UKHSA acted as quickly and as comprehensively as possible. In addition to cases involving students at the University of Kent, there were 2 cases identified involving 6th formers in Year 13, one of whom has sadly died. UKHSA made contact with the head teachers at both schools first thing on Monday morning and have worked closely with schools to provide information, advice and support, including a letter to parents that was issued that same day. We are working closely with DfE on wider communications to schools across the Kent area, and a briefing with schools has taken place this morning. Mr. Speaker, the strain associated with this outbreak is meningitis B, known as Men-B. It is uncommon, but as we have seen, a serious and potentially lethal strain of meningococcal disease. The onset of illness is often sudden, and early diagnosis and treatment with antibiotics are vital. It doesn't spread very easily. The bacteria is passed to others after a long period of close contact. For example, with living with someone in shared accommodation, through prolonged kissing, or sharing vapes and drinks. However, the symptoms are also easily mistaken for other common conditions, even for something like a hangover. And so, Mr. Speaker, let me now set out the current advice from UKHSA. Anyone who attended Club Chemistry on March the 5th, 6th or 7th and anyone who believes they were in close contact with someone who's confirmed or suspected to have meningitis should attend a treatment centre and receive antibiotics. There are 4 centres open in Canterbury today, with 11,000 doses available on site. Details about the location of these centres are available on the UKHSA website and are being promoted by the UKHSA, the NHS, my department, schools and the university, as well as the BBC, and I encourage all media outlets to do the same. There is no need to book an appointment. A single course of antibiotics is highly effective in preventing the contraction and spread of this disease in 90% of cases. If you become worried about yourself, your child or a friend, particularly if symptoms are getting worse, please seek medical help urgently. Anyone with symptoms should call NHS 111 or in an emergency dial 999 to seek medical attention. Mr. Speaker, people are understandably asking about a vaccine. From 2015, the MenB vaccine has been available on the NHS as part of routine childhood immunisations, but clearly most students would not be vaccinated. Given the severity of the situation, I can confirm to the House that we will begin a targeted vaccination programme for students living in halls of residence at the University of Kent in Canterbury, which will begin in the coming days. UKHSA will provide further advice on other cohorts in the coming days. On the question of wider eligibility, we obviously follow the expert independent advice of the JCVI. In light of this latest outbreak, I will be asking them to re-examine eligibility for meningitis vaccines. I will do so without prejudicing their decision because we have to follow the clinical advice on this. Mr. Speaker, I will keep the House updated as the situation unfolds, and I commend this statement to the House.
Secretary of State Stuart Andrew.
Thank you, Mr. Speaker, and I'm grateful to the Secretary of State for advance sight of his statement and for the clarity he has provided to the House this afternoon. Our thoughts, too, are with the families of the 2 young people who have so tragically lost their lives. I cannot imagine the pain they must be going through at this difficult time. This will also be an extremely distressing time for parents, students, staff and the wider community across the South East, especially as I understand 2 more cases have just been announced. Indeed, yesterday, friends of mine were very anxious about their own son, who was in the vicinity over the weekend. I also want to pay tribute to the NHS staff, public health teams, school and university leaders, and all those working at pace to respond. I welcome what the Secretary of State has set out on the daily publication of figures, the scale-up of antibiotic provision and the decision to introduce a targeted vaccination programme for students in halls of residence, alongside seeking further advice from JCVI. However, there remain a number of important questions. First, on the timeline, as there have been concerns raised out there. The Secretary of State has set out the sequence of events in detail. But can he be clear about the threshold used for wider public communication and whether that threshold is being reviewed in light of this outbreak? He also set out that head teachers were contacted on Monday morning. Can he clarify when those schools were first identified and whether there is a need to review how quickly educational settings are brought into the response, given that cases were identified several days beforehand? Secondly, on the nature of the outbreak, while many cases are linked to a single venue, can he confirm whether all cases are believed to be part of one cluster, or whether there remains a risk of multiple sources of infection? Thirdly, on escalation, given the involvement of both a university and schools, can the Secretary of State set out what criteria are being used to determine when more extensive interventions are required across educational settings? This situation will undoubtedly cause concern among families, particularly with the end of term approaching. Can he therefore set out what steps are being taken to manage the risk of onward spread as students return home? And what advice is being provided to families and local health services in other parts of the country? Can he also confirm that public health messaging is fully consistent across schools, GPs, local authorities and NHS services, so that families receive clear advice wherever they turn? And what steps are being taken to counter misinformation online where false claims may undermine confidence in public health advice? Can he also confirm that local laboratories, intensive care capacity and public health teams are fully resourced to manage any increase in cases, and that supply chains for antibiotics and vaccines are resilient should further clusters emerge? Finally, while I welcome the targeted vaccination programme and the decision to seek further advice from JCVI, the Secretary of State has acknowledged that most students would not have been routinely vaccinated against meningitis B, and protection among older teenagers is clearly not as strong as it is in infancy. Does he accept that this creates a particular vulnerability among older teenagers and young adults? And will he ensure that any further advice on eligibility or wider catch-up measures is brought forward as quickly as possible? Mr. Speaker, this is a serious public health situation. It is right that the response, though, remains calm, evidence-led and focused on protecting patients and supporting those families affected.
Firstly, Mr. Speaker, can I thank the Shadow Secretary of State for his constructive response and support as we respond to this incident, and also welcome the way in which he has rightly brought scrutiny to the response. And I should say from the outset, Mr. Speaker, that obviously once we're through this, we will obviously look at the handling of the UKHSA's response at every point, because inevitably there are always things that we can learn and seek to do better. The balance that needed to be sought in terms of public communication, Mr. Speaker, was to make sure that people were informed in a timely way, but also to make sure of two things. Firstly, we didn't spread unnecessary anxiety and concern. And secondly, that having been made aware of the risk, that there was a channel through which people could receive support. So as I set out in the timeline, in response to individual cases, thorough contact tracing was undertaken, antibiotics were offered in those direct contacts in those cases, and then by 5 p.m. on Sunday, we had the antibiotics more widely available, and 6 p.m. public communication went out. The schools were identified during the course of Sunday. That wasn't a straightforward experience. And in the case of those schools, the two schools, Simon Langton Grammar School, Queen Elizabeth's Grammar School in Faversham, were both contacted first thing on Monday. We're also looking at Norton Natchball School in Ashford, where there may potentially be another case, and we are working closely with those schools. They were notified on Monday morning, and we've stood up wider school briefing. We will look carefully at whether we could have done more quickly to identify those schools and to make contact ahead of the Monday morning. The Shadow Secretary of State asks about the criteria for educational settings and the sort of wider availability of vaccination. We are looking at this actively with UKHSA, and we'll make announcements about further cohorts in the coming days. In terms of local NHS capacity, the NHS in the South East region are supporting UKHSA, who are the lead agency, in the response to the bacterial meningitis outbreak. Kent and Medway ICB have stood up and are currently operating a hub at the Kent University site to deliver prophylaxis to students, and a second site has been open too. We've obviously made sure that in responding to patients presenting at hospital, that appropriate support is in place for those hospitals. The Shadow Secretary of State also asks about supply of antibiotics and vaccination. We're confident that we have the right levels in place to respond, and obviously as we think about potentially widening cohorts, we'll make sure that supply is available in a timely and effective way.